I cannot hear you. Are you muted or mic is open?
Okay, good morning.
Yeah, good morning.
Hello, Smith. Do you remember me?
Yeah, doctor, I had seen you in the ward and you are a very good doctor. I can see you working all the time.
Thank you, Smith. Yes, today I observed that you wanted to discuss something.
Yes, doctor, yes. Actually, yesterday, few doctors were discussing about audit. So, and I am new to this hospital. So, doctor, what is audit cycle they were discussing?
Yes, I can also see that you are very keen learner. You want to learn new things. So I will explain this to you by drawing, so you will have better understanding.
Sure, sure, doctor. Thank you.
Okay, so for this I will draw.
Mm-hmm.
Mhm.
Yes. Verbally, you can say verbally, yeah, no issues.
Yeah, okay. So first of all, to explain audit cycle, I will draw. But before that, starting, do you want anyone else to join our conversation?
No, doctor, no, it's me only. Thank you so much.
Okay, so no problem. So I would like to know that uh, do you have any idea about audit cycle? So I will start from where you
Mm,
stop.
No, doctor, no, I don't have any idea.
Okay, so the audit cycle is a cycle which helps us in improvement of the quality of care we are giving to the patients.
Oh,
Like
nice.
first of all, yes, please.
Yes, yes, please. Go on.
Okay, so first of all, we will choose a topic
Mm-hmm.
like about which anything with the like we want to improve. So we will choose a topic, like for example we want to improve the quality of patient care in OPD.
Mm-hmm.
So we will our topic will be the like OPD cases.
Mm-hmm.
So then we will select the standards.
Okay.
This means that we we are working for like for example 12 hours in OPD, and we are managing patients, but we cannot give proper time to the patients like we should give. Some patients require more time in doing taking the history, doing examination, and then prescribing the medicines and doing some tests. So and some patient need less time. So but we are not giving like the time required by the patient to every patient because we have much load. Are you following me?
Yeah, doctor, yeah, I'm there.
Okay, so then we will collect the data. Collect data means that we will first of all we will take the data from the doctors who are working in OPD, that
Mm-hmm.
how much patient they are seeing daily and how much time they are giving to every patient.
Mm-hmm.
Okay.
Okay.
So then after the next step will be data analysis. We will collect all the data from the different doctors in OPD, and we will arrange them. And after analyzing an analysis of the data, we will come to a conclusion that which changes we are required to make. Are you following me?
Yes, yes, doctor, I'm there.
So we will implement some changes, like the changes in a form that we will increase the number of doctors in the OPD, so all the patients will get their the desired time each patient requires.
So, doctor, if you increase the number of doctors, is it not a burden over the NHS?
Yeah, this is a very good question. There will be, but as I already mentioned, that there is a burden on the doctors also, and every patient they have to wait for long hours to for their turn.
Okay, so doctor,
So,
who will decide how many doctors are required, extra doctors are required, how we will understand, how will we measure?
Yes, after collecting the data, we will involve the hospital, hospital authorities. So we will give the data to them and we will explain them. So accordingly, if they want to make the changes and increase the number of doctors, so they will implement.
Okay, okay. And
Um,
if they reject our idea, then what will happen, doctor?
yes, yeah, there's a very good question. Yes, if they reject this, so then we have to make a new suggestion, and we have to again like work on this again. We have to collect the data, and we have to suggest give some other suggestion instead of increasing the number of doctors.
Mhm.
Uh, we will think some of other way.
Okay, so doctor, how should we finalize the topic? Like you said, any we need to fix the problem, right? So
Yes.
how we can choose that one problem or topic for this audit?
So we can choose the topic within for our department. We can choose the topic for our department, like we are working in a pediatric department.
Mm-hmm.
So for other department, they will identify their problem, the
Six
problem they
minutes.
are facing.
6 minutes.
Okay.
Okay.
So the problem they are facing, the other departments, they will choose problem they are facing.
Okay, doctor, I heard the quality improvement. So is it the same thing, audit and quality improvement, or is there any difference?
For the quality of improvement also, there is a team. It's also a teamwork. We cannot say exactly this is the same thing, but this is a part of audit cycle. Like at the end of doing completing the audit cycle, we will also improve the quality.
Okay. And doctor, one more question, last question. That what is the audit? You say we do audit, then research also we have one department, right? Is there any difference between audit and research?
Yes, there is a difference between audit and research. Like audit is done among one department, and research is done for research. A whole research can be done in a whole hospital or in a whole city or in a whole country. Like there is uh, the boundaries are not defined, like defined, but it's a big boundary.
Okay.
And also there is in research there are a large group is involved, and also there is a case and control, but in audit a small group is involved, and the case control is not there. And for audit or the hospital people are involved, and for research there are special people, they are called researchers, they do the research.
Mm-hmm. And doctor,
And
do we need to take permission from for the audit from someone in the hospital? We can do directly.
like if you want to improve something, so we can just involve the head of the department. Like we don't need much um, uh, like just we can involve our head of the department, but for research we have to take permission from the higher authorities.
Okay. Mm-hmm.
So do you have any other concern?
Yeah, no, doctor, no. Thank you so much. It was a very good
Okay.
session.
uh, yeah, thank you. So can you summarize what we have discussed?
Yeah, doctor, today we discussed what is audit and what are the steps of audit, how we choose the topic, and then how to do re-audit. Then what is the difference between this and quality improvement, then what is research, right? So this is
Yeah,
what we
yeah,
discussed.
very nice. So if still you have any confusion, you can write down the confusion in points, and we can discuss, and we can have another meeting. Also, I will provide you some websites from which you can read the topic. And also, why don't you prepare a CPC on this
Yes,
so
yes,
you can
yes,
present
that
it?
will be a fantastic idea so that my colleagues can understand. Time up.
Okay. Okay.
Thank you.
Thank you.
Thank you so much for this session, this scenario, Dr. Okia. So, how do you feel?
Um, I think the example was not good, but nothing else was coming to my mind.
Yes, yes. Okay, what else?
I think I did a little better than before, because before I was unable to say anything about audit.
Okay, when you did last time?
Last time, like 1 month back, I
Okay.
did it.
Okay, that's nice. So do you see some improvement? That's a great thing, right?
Mhm.
Okay, so your
Yeah.
confidence, you have very good confidence. Your clarity in your thoughts is very good, means your voice is very clear. So that gives a good impression. But I will tell you a few points here. First of all,
Hmm.
you started and you start. I will point out small mistakes also so that you can improve. Means this that will be fine tuning for your scenarios, right? Hmm?
Yes, yes. This is
So
very difficult
yeah,
topic
this
for
one
me.
I will start with small points. You said hello,
Mhm.
hello, good morning, Smith, right? So you didn't check my
Yeah.
identity. You directly you were assuming that you know me,
Yeah.
right? So
Yeah. Yeah.
thought that you should introduce yourself and then you should ask, am I talking to Smith? Am I right? Right?
Mm.
Something
Yeah.
like that. Instead of saying direct hello, Smith, correct? So
Yes.
that is usually we do. That is not a big mistake, but small correction.
Mm.
After that,
Yes.
your greeting, repo, everything was going good, but you started the scenario at 1 minute and 40 seconds. So
Mm.
you asked me, do you have any idea regarding audit? And that was around 1 minute 37 seconds that time. And then you said,
Mm.
I will explain you. But you were drawing the diagram that is very good. So
Mm.
1 minute 40 seconds, I think it didn't do too late, little late. You should start scenario ideally at 40 seconds or max to max 1 minute.
Mm.
Because examiner is
Oh,
looking at you. Uh,
yes.
hmm. After that,
Yes.
you were talking a lot. Means you were checking my understanding, but I could understand that you started your scenario at 140, 1 minute 40, and at 3 minutes, uh, 5 seconds, you asked me, "Are you following me?" Intentionally, I was silent, but in between, I was
Mm.
doing cooing, right? Like, okay, like this, right?
Mm.
To get involved myself. But you checked my understanding at 3 minutes, 5 seconds means you were 1 minute 25 seconds. You were continuously talking, and it looks like a lecture. You are giving me a lecture. It was not a conversation. Communication is a conversation in which both the parties will be involved almost 50-50. Hmm? Right?
Yes, you are right,
Depending on the
guys.
scenario, but it may be plus minus 10%, but it might be 60-40, but 50-50 is the ideal way. Okay,
Mm.
if I say I don't
Yes.
know anything, then it may be 40%, 35% from my side and 65% from your side. Uh,
Mm.
then you said suggestions, something. Your topic, as you said, your topic. So no need to discuss any topic in detail here. Just give the example. Because this is we are
Mm.
talking about the audit itself, not talking about a particular topic of audit. That is a waiting time. So
Mm.
you are going deep in the audit, deep in the waiting time.
Example.
That how we will.
Yes.
So you are not the authority to suggest NHS that you will increase the employee, and that is very big thing, right?
Yes.
And then again you said that I will check and I will give suggest. So you are using the word suggestions. Suggestions. We are not here to give suggestions, right? We are doing audit.
Mm. Mm.
So audit and
Yes.
suggestions are different thing. Correct.
Oh.
Then I said, okay,
Mm.
from where you will take the permission? You said head of department. So head of department, why he will give permission for the audit, right? So there is a separate audit
Mm.
department is there in the hospital, and you will give the proposal to the audit department, and they will give you the permission, right? Or
Mm.
educational supervisor can help you in that. He can help. He cannot give permission. He will help you
Mm.
in finding the topic or connecting to the audit department. Correct.
Mm. Yeah.
Then you said at the when we were summarizing, you asked me to summarize. I did nicely. You asked me that do you have any other question? That was very nice, excellent. And you said that if you have any confusion regarding this topic, you can come back to me. And you should use this word 2 times, confusion. You have confusion. So I don't have any confusion, right? And we cannot say
Okay.
any doctor that do you have confusion, right? So why
Yes. So what should I say? I was thinking. That's why I stopped. Also, that what should I
you
say?
can say you if you have any questions regarding audit, if you have any concerns,
Question.
concerns is not questions better, or if you do
Mm.
not understand some points regarding audit cycle, then I'm here to help you. You can contact
Oh,
me, right?
yes.
So that was not a good word. So these were the few
Mm.
things where you should be very careful. But that is very important. You were talking, 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 going one way mostly.
Mm.
Because in this scenario,
Mhm.
I remember that I was involved 10%, 10 to 15%, 80 to 85% you
Mhm.
were saying everything. Correct?
Yeah, yeah. Yes, yes, you're
Okay,
right. We should
so
not happen.
yes. So before going on, you have any question here? Okay.
No.
So remember,
It's,
whenever communication is an art, right? Because I think you are from Asia. So we
mm,
Asian doctors, we are not trained in communication, and communication is a big art
mm,
where
mm,
communication is just like you can say that you are talking to your sister at home.
mm,
So your sister is almost of your age and you are talking, so both are involved equally, correct? And you have to listen to your sister also. It is not like you will be talking and she will be listening. Then it will be you are a teacher and she is a student, right? So we should not do like that. And what happens, most of the candidates I have seen that they are in hurry to finish the task. That is the main problem.
okay.
They feel that
Yeah.
my time is 9 minutes and I have to so forget 9 minutes. Because the role player will help
Mm,
you. Okay, so
mm,
he will look after the time, what is the time, then he will or she will stop that asking the question. So you will understand. But
mm,
be relaxed and don't put any agenda from your side, right? Don't from
mm,
when you are sitting outside for 4 minutes, you make the notes and you have your own agenda in mind. I will tell this, that. No. What is the agenda in role player's mind? That is very important. What he or she is planning to ask you, right?
mm,
So we should apply our agenda, but that is only 20-30%. Rest of the things, 70% time you have to listen to the role player and answer the questions of what he or she is asking. Hmm? So
mm.
we should be done.
Yeah.
For example, a patient is coming to your outpatient department. So are you going
Mm,
to give the knowledge or are you going to give a lecture to the patient? No, right? The same way you
mm,
are talking to a medical student or a patient in the scenarios.
mm,
Okay, so I would like to give some idea regarding audit cycle here.
yes.
So audit cycle is just for example, you just imagine we have one hospital. We are running one hospital, small hospital in our setup. Hmm. The
Mm,
and another example is what we do for financial transactions. We do audit, right, every year when we file income tax return for our hospital. So what we do, that is
mm,
called audit, right? So whatever profit and loss we are looking after through the audit, right? When we file the income tax return, we see the profit and loss in our company, in our hospital. The same way here we are to doing audit for the patients. What benefits they are getting regarding health and what loss, or you can say what is not good for their health or for the complete cycle, means when the patient will enter your hospital and when he will leave the hospital, so he is happy or not. If he is 100% happy, it means your audit is successful, right? No need to do again
mm,
audit, right? But this is a continuous process audit. So every year we do financial audit. Same way we have to do audit for everything or some particular
mm,
topics on and whenever required. So here what
mm,
is when I said when you will how will you decide about the problem of the topic, right? So there is a funda called SMART. So whenever we choose a topic or a problem in the hospital, that should be SMART topic. So what is the meaning of
mm,
SMART topic? Smart means this should be specific, that should be measurable. If you cannot measure the improvement or whatever topic you have chosen, then there is no point. Then it should be achievable. For example, you said we will employ extra employees. That is not achievable, right? Then
mm,
it should be relevant to the topic, right? Relevant to the hospital. Then it should be
mm,
touching topic, right? Hmm. Touching topic
mm,
means when it should bring benefit to the hospital and to the patients both. So SMART is the very good mnemonic to choose the topic or the problem for the audit. So when you suppose you are a new doctor or a new SHO in the hospital and you want to audit, so what you do, you take suggestions or opinion from the seniors, your clinical supervisor, education supervisor. Then you can also read from the websites topics, and you can observe in the hospital also what improvement we can do. So this is how you will choose the topic. So once you choose the topic, I have a mnemonic that is called ISO circus. Okay, this is a mnemonic too for audit cycle. So when you start
mm,
saying Do you have any idea regarding audit cycle? He will say yes or no, whatever. If he says yes, then you ask and then appreciate. Oh, excellent! You have a very good knowledge, sound knowledge about audit. I appreciate that. Then you start. Okay. Apart from that, I will explain you, and then you can write down ISO circle outside the station when you are.
Hmm.
So here we will talk about 6 points. So you can say in audit cycle we have 6 to 7 points which we should consider. First is I for identification of the topic. So how we will identify the topic? Like the smart approach. Then set the standards. Then what we will do? You can draw a diagram, audit cycle like different points here, in which here audit cycle and like this, and you show him or her. Okay, whenever diagram is required, you must draw, otherwise they will deduct your 2 marks. So here ISO means I for identification of the problem or the topic with smart approach. Then set the standards. So what kind of standards you want to set? Means highest standard. Whatever practice is going on in the hospital, that is your local criteria. But that we need to compare from a standard thing. So standard guidelines. So it may be local, national, or international guidelines. So whatever guidelines you feel that is best, but most of the cases local guidelines are the best, local or national, because that is according to their scenario. So you will set the, for example, you have standard set the standard nice guidelines, for example. So you have set the standard guidelines from the nice guidelines. This is an example. Then observe the practice. So, okay, you have in your mind this practice or this, suppose in the NICU preterm in the one hospital, premature babies are born and mortality is, for example, for 24 weeks, mortality is 40%. It is standard guidelines, all our national guidelines. Now you see there is 50% mortality in our hospital for the 24-week babies. Then it means we are lacking, we are 10% lagging in that criteria. So we have set the standards. Now we are observing, observation is that we have 50% mortality as compared to 40%, right? So this example I am giving you, but no need to tell them. For just a prematurity, mortality in prematurity, maybe waiting time, maybe parking facility. Hmm? Like this, you can tell 2, 3 examples you can give. Then you have observed the current practice in this hospital. Now you will compare these both, whatever standards are there and whatever observation you have done. So observation may be current observation or maybe previous records also. So now you are comparing both the things, observation and standard guidelines. Then whatever difference you found, then you will discuss with the audit team, audit department, and then with their permission, you will implement these differences, these ideas in the hospital if they give the permission. If the your smart approach is there, then they will not deny this to implement. So you will I for implement. Once you implement the now, you will see what changes you got. Suppose you have implemented the ideas and now you see that there is 35% mortality only in 24-week babies, right? As compared to 40% of standard guidelines. So this is a very good improvement. So you have done improvement, right? Then re-audit. So now how will you understand this benefit you got? So that is through the re-audit. So you will do audit again, and then you will come to understand, yo, this is a 15%. I have reduced the mortality by 15%, right? So this is I'm giving example just to understand. You need not to give all these examples to the in detail to the medical student. So this is re-audit. Re-audit usually takes 6 months to 5 years. Hmm? Within 6 months to 5 years you have to do re-audit. It is not like after 10 years or like this. So this CUS you forget safe circus, so CIR of the circus and ISO. These are the 6 points we discuss in the audit cycle. Now after that I ask you, what is the difference, doctor, between quality improvement and audit cycle, right? So there is a big difference. So suppose this is audit
Mhm.
cycle, and you just quality improvement, you just say we will improve and something vague answer you had given. Sorry, quality improvement. So audit is done for the medical things only, right? Medical, like related to patients. This can be done for medical and non-medical both. Then audit is for long time. We do like for 3 months, 6 months, 1 year, like long time, long period. Here we do for days or weeks. So this is a short period, short duration. Correct. Then for this, we need to ask the audit department. Here, quality improve, no need to ask, and you can do directly asking the senior or the in charge, and you can do the Quality improvement. Quality improvement usually done in 4 steps. PDSA cycle is there. PDSA, right? So that is what? Plan, do, study. Sorry, plan, do, study, and act. Right? This is PDSA cycle. Plan, do, study, and act. So this is through. So what is the example of quality improvement project? Do you have any example? This is instant quality. If you feel now and within hours you can improve. So that is called quality improvement, right? So what is any example of quality improvement project? Hmm.
No idea.
For example, it is a very means winter season is there, and there is no hot water in the emergency room or in the waiting room or the casualty, right? If people need warm water to drink, because it is very temperature is very minus minus 10 -5, so this is not the facility is not there, immediately you can provide this facility. So this is called quality improvement, right? If you have done a good parking arrangement, for example, parking is there very far from the outpatient department, but for the old people, old patients, you made the arrangement that parking will be close to the outpatient department. This is also a quality improvement because they cannot walk for long. So this is another example of quality improvement. So this is the difference between audit and quality. Audit is what is the profit and loss of the patient's health. I mean, we want to improve the healthcare standards, right? For a particular topic with the smart approach. Here also we are improving the quality of healthcare, but that is for non-medical things also. For example, I said hot water or warm water facility. That is not medical thing, or it can be medical also. So this is the difference. Now you, I asked you, doctor, what is the difference between audit and this
Research.
research, right? Audit and research. So you have to give at least two statements about this audit and research. Research we take new topic, right? The things which are not there in the market, right? New research. For example, we have done research for the COVID vaccine. So there was no vaccine available till now in the world, and we have taken the new topic like COVID, and then we did the research and we got the COVID vaccine. But here audit is done for the already existing things, right? So while waiting time or whatever we are discussing, log maybe sepsis in the NICU. So that is already existing, and this is new topic.